Hello, my name is Sophie, and today I'm presenting some research I undertook with my colleague Frey as part of Cardiff University's Research Opportunities Programme. This study sits within a larger piece of research which is being conducted by Madeleine, a lecturer and researcher from Cardiff University. So research has shown that physical activity helps prevent major diseases, manage pain and promote mental health. Despite this, over 39% of people don't meet the recommended amount of physical activity, and this being higher in certain demographic groups. To combat this, NICE guidelines recommend that healthcare practitioners, including physiotherapists, encourage their patients to be physically active through short talking interventions built into their routine practice termed brief advice. NICE defines brief advice as verbal advice, discussion, negotiation, or encouragement. It recommends that brief advice for physical activity should be tailored to the individual, provide information about local opportunities to be active, and follow research-based behaviour change principles. Despite these recommendations, research suggests that physios don't routinely offer brief advice, and physios say that the barriers to doing this include lack of time, lack of an agreed structure for how brief advice should be delivered, amongst other things. Furthermore, less than half of physios routinely signpost to local opportunities to be active, despite NICE recommendations. Physiotherapists say that they lack knowledge of these opportunities, especially knowledge of activities suitable for certain demographic groups, such as those with disabilities. So our pilot study looked at the feasibility of creating a database of local physical activity opportunities, such as an exercise class at a leisure centre or a local walking group. So this database could be used by physios to help in their delivery of brief advice. The database would contain information on these physical activity opportunities, for example, locality, cost, timing, accessibility, and qualification of instructors. Having this information available would aid physios to find suitable activities to signpost their patients towards, as well as providing the patients with the information that they need to support a positive behaviour change towards physical activity. The database would be searchable, allowing physios to find activities which meet certain criteria, therefore tailored to patients' abilities, preferences, and barriers to exercise. And ultimately, it would support the delivery of brief advice by providing a tool which is easy to use, time economic, and allows individually tailored advice. It would also combat physiotherapists' lack of knowledge of local physical activity opportunities, especially for certain demographics. So the first stage was to design a questionnaire which would be used to collect information about opportunities from local providers. We based the information we sought to gather on behaviour change research, which describes the information and factors that are important to people when adopting physical activity behaviours. We targeted publicly funded physical activity providers in the Cardiff area. We did this to save time, but also as publicly funded providers are more likely to cater for certain demographic groups, shown by research to be less likely to access physical activity. We created an online survey which was sent to providers via email, following an initial contact and consent procedure, either over the phone or via email. We also manually collected data ourselves from information already publicly available on the internet. So out of the 38 providers we contacted, 39% ended up participating in the study. The majority of those who didn't take part consented over the phone, but did not fill in the consent form, and we were unable to make contact with another significant proportion at all. Only a small number refused to participate in the study after the initial contact was made. We gained information about 217 different physical activity opportunities in total. And this was due to the fact that large providers such as leisure centres provide many different physical activity opportunities, such as different exercise classes and swimming sessions. The data was used to populate an Excel spreadsheet, which we formatted to be searchable and as user-friendly as we could. This comprised our final pilot database. Our pilot study identified several areas of limitation for creating a database of local physical activity opportunities, and I will discuss these now alongside possible solutions. The first limitation was that some physical activity providers were unwilling to commit their time to taking part in a pilot research project that they would see no immediate benefit from. An actual live database in use by physiotherapists and patients would have real benefit to activity providers by advertising their services. Therefore, if this wasn't a pilot study, they may have been more willing to take part. Another solution would be to create a subscription service, which would offer new and existing providers a chance to submit their details to the database. And this would have the dual benefits of advertising the database as something desirable to be involved in, as well as aiding in data collection. A second limitation is that large amounts of manual data collection is time consuming, and return in data is often poor compared to the time invested. So the subscription service I've just described would alleviate much of the manual data input. And furthermore, it might be possible to use algorithms to do some of the data mining, particularly for leisure centres, which generally have standardised websites. And finally, although we were able to create a searchable database using Excel, our limited time frame and lack of specialist IT input limited the usability of the final database. A future project would benefit from increased input in this area. We especially felt that a mapped function or a postcode search, which could search for activities within a set radius of a patient's address, would be an important feature for finding suitable activities for patients, which were more likely to influence positive behaviour change. Thank you very much for listening. If you do have any questions about the project or would like to get in touch, feel free to do so. Contact details are on the slide.